Hello and welcome to the RCSI MyHealth Series. I'm Professor Ciaran O'Boyle, and today we're going to discuss supporting child and youth health this winter. This MyHealth series explores a wide range of areas in health and well-being and brings together some of our leading healthcare experts with the goal of empowering you with the knowledge to make informed decisions about your own health and about the health of your loved ones. As we all know, the Irish government recently mandated a move to level 5 of the National Framework for Living with COVID-19. And in adherence with level 5 restrictions and following public health guidelines, this episode of My Health is being recorded remotely, as you can see. So it will look a little different from the other episodes in the series. Today, I'm delighted to be joined by Professor Mary Cannon, Professor of Psychiatric Epidemiology and Youth Mental Health in the Department of Psychiatry here at RCSI. And Mary is also a consultant psychiatrist in Beaumont Hospital. I'm also joined by Professor Jonathan Hourahan, who's the head of the Department of Pediatrics at RCSI and a consultant pediatrician at the Children's Hospital Ireland in Temple Street. And we're also joined by Professor Paul McNally, who's Associate Professor of Pediatrics at RCSI and a consultant in respiratory medicine at the Children's Health Ireland in Crumlin. And we're going to discuss the topic of supporting child and youth mental health in more detail with our experts. So Paul, can I turn to you first, please? Respiratory infections in children are very common, particularly in winter time. What do parents and caregivers need to know about respiratory infections in children?
Yeah, thanks, Ciaran. So respiratory infections, particularly in wintertime, I think we can see in younger children, not only are they common, but they're really part of normal life. So I suppose we've become more and more accustomed to intolerance of illness as the decades have gone on. But we have to, I suppose, stop and remember that particularly viral respiratory infection in the wintertime in children is just part of normal life, as opposed to a sign of weakness or immune problems in children. The important thing about it, though, I suppose, is the character of the episodes. We all know, everybody's had lots and lots of colds. We all know that a normal respiratory infection is self-limiting. It comes and goes of its own accord, and there's a definite start and end point. And I suppose that's the key thing as well when we're looking at kids. As long as episodes start and finish of their own accord without causing any significant problems, that's really what we're looking out for. And I suppose as kids grow older, the severity and the marked symptoms with respiratory infection probably reduce a little bit with time. So the vast majority are uncomplicated and they resolve within a week or two. However, there's a lot of overlap between respiratory symptoms and some other conditions that can cause upper respiratory symptoms like asthma and like allergies that we'll talk about in a while. And so it's very important, I think, for parents, especially new parents, to make sure that they're as well informed as they can be about normal patterns of respiratory infection in children.
So as pediatrician, Paul, you would see also more complicated respiratory conditions. And what characterizes those compared to the simpler conditions that we've just been talking about?
So again, it's pattern. And that's, I suppose, what we're called on a lot, is to try and establish if a child is presenting with recurrent symptoms, whether they are a normal, healthy child who's just having slightly more infections or slightly more obvious infections than other kids, or whether there's something underlying it. And I suppose the common thing that everybody thinks about is asthma. It is very common. Thankfully, I think reducing a little bit in prevalence, but it's one of the ones that we always think about. And so a very common referral to primary care, to your general practitioner, and also to specialists, is to try and establish whether somebody has asthma, because of course that's treatable, and we can, if somebody has a presentation like that, you can treat it and effectively reduce the burden of symptoms that the child is getting. So I think the commonest presentation we see is viruses, and one of the things that discriminates viruses from bacterial respiratory infections or things like asthma, which are caused by inflammation, is the fact that the way viruses spread is they cause symptoms in lots of different places. So you tend to get symptoms in your nose, your throat, your chest, and perhaps even your skin or some vomiting all at the same time, whereas bacterial infections definitely stay locally and spread locally. So that's often one of the easiest ways for parents to distinguish one from the other. Difficulty breathing in children is always abnormal, and you know, outside of infancy, typical respiratory infections don't present with that. And the other thing, I suppose, is really excessive coughing outside of what would be expected to clear one's airways, and also prolonged symptoms that go on for weeks and weeks and weeks or months after an infection. So they're the key things that we want parents to look out for, that will discriminate between normal run-of-the-mill recurrent but benign infections, and then something that's a little bit more serious and perhaps treatable to reduce to improve quality of life in kids.
Excellent. Okay, Jonathan, can I turn to you? Your area of research is on children's allergies, and that's a major concern for parents and for caregivers. Can you tell us a bit more about why children have or why they develop allergies in the first place?
Yeah, thanks, Ciaran. They're common conditions. You know, as Paul says, asthma is the most common chronic condition in childhood. And a lot of children with asthma have allergies that trigger the spasms in their airways and cause them problems. We think there are theories relating to the amount of vitamin D that we have in our bodies now that our exposure to sunlight is decreased with all sunblock and covering ourselves up. Vitamin D is an immunologically active substance, and there's evidence maybe that lower vitamin D levels are associated with allergies, but it's seems to be more relevant that we live in a different way now than in the past, with chronic bacterial encounters, large family sizes, families living in complex groups with other members of their family. And it's thought that in the developed world, it's the socialization that we have is different to how it used to be for large communities. So the immune system the concept is that there's some redundancy of the immune system, and you've got idle antibodies looking for trouble. And they find foods and inhalants when they would have normally found bacteria and worms and bugs of other kinds. And in fact, it's kind of notable that we're having a lived experiment of this hygiene hypothesis now, because children have been locked down for a few months, as we are definitely noticing that the amount of viral encounters that children are having are down. The number of children presenting to the emergency departments with viral illnesses is down. And we've got a study looking at some babies. We're hoping to recruit up to 1,000 babies born during the first lockdown to see if the absence of that bacterial and viral traffic through their bodies in the first few months of life means that they'll have more allergies in the first few years of life. I can't say what the outcome will be. It just seemed like a good idea. We're chasing it now. But hygiene, we're all meant to be a little bit dirtier than we are at the moment. Okay, everybody washes a lot. You wash your hands, your table counters are spotless. Maybe they're a little bit too spotless.
That's so interesting. So it could be that in our grandparents' time, their immune systems were stronger than they are today. Would that?
I think they were fighting different things.
Yes.
I wouldn't say they were stronger because they had poorer nutrition and they were heavy smokers. So they obviously had other triggers. But they were certainly fighting bacteria and viruses at a rate that we don't have to do nowadays.
Yeah. So if we take that a bit further then, Jonathan, what are the main causes or triggers and the main symptoms for the allergies that we see in infants and children? What should parents be aware of?
Well, the common indoor allergens in what is the northwest of maritime Europe are house dust mite, which is a little tiny insect related to spiders. And that lives off squames of skin that are in our beds. And people are allergic to protein in their feces, unfortunately. It all sounds a bit awful. If I gave you a new pillow today, Ciaran, in a year's time, it would weigh 150% of its weight today, shall we say. And people are inhaling that all night. So when they wake up in the morning, they're usually asleep, but their sleep can be disturbed. But in the mornings, they take deep breaths. And one of the major symptoms for that allergy is morning sneezing. So it's often the first thing families notice is, oh, bit up, because they can hear him sneezing and coughing. And then indoor allergens, cat is a very tenacious hair in anybody's house. Everybody knows that. So it takes sometimes 3 years to get cat dander out of a house after a cat leaves it or the family move. And other allergens. In the summer, then we've got pollen, but in the winter, it's house dust mite and cat and dog hairs. So hard to do a lot about it, except manage it once you've recognized it. There's no reason to go after it unless you have symptoms already. There's no way to make a house perfect for a family before allergies come along, I don't think.
I was feeling very positive there until I heard about my pillow being 150% the weight that it was when I started out. I need to go and think about that, John. So COVID-19 it's adding a whole additional set of worries for parents, and they're thinking about this in the winter. Is there an overlap between the symptoms of COVID-19 and the symptoms that we see in allergies? Yeah,
I think the winter symptoms are chronic, low-level chronic nasal congestion, blocked nose, having to mouth breathe while eating. You can spot an allergic child quite easily by their sort of longer face, because their mouth breathers all the time. I think COVID, as we get to know it, you have acute symptoms. I think obviously we have children who are asymptomatic and we never know they have it. So I don't know how we're going to find that. But I think infections in the normal way that Paul has been talking about, fever, general snuffliness, they're kind of acute and short-lived. The key difference for me for allergies and chronic infections or acute infections is allergies don't cause temperatures. Okay, so if a child has a temperature, they've probably got an intercurrent infection, and it might be on the background of having allergies, because allergies affect up to 25 to 30% of children. So it's a common background condition. And then we'd have the spike of whatever intercurrent problems they had with a cold that they got at school or in playgroup or anything. I think we can be generally reassured that children don't appear to be suffering a huge burden of coronavirus. But I think we're going to come back to that.
Yes, okay. And we'll come back around. Thanks very much for that, John. Mary, can I turn to you as a psychiatrist? I mean, we've just been talking about some of the physical issues around children's respiratory conditions and so on. But if we look more broadly at what's happening at the moment and these changed times that we're in, how is the pandemic affecting children and young people in terms of their mental health, their psychological well-being?
Yeah, thanks, Ciaran. I suppose there's a danger that we can overlook mental health issues, and we're also focused on this virus and physical health. Obviously it's a global experience. It's a global pandemic, but it is affecting people very differently, and we have to remember that people are not all reacting the same way, and children particularly aren't all reacting the same way. There was an interesting study carried out in the very early days of the pandemic by Young Minds in the UK, and they surveyed children to find that the majority were feeling more anxious or feel that the pandemic had worsened their quality of life. But then there was a minority, about 7% of children, who actually felt happier. And this, I suppose, would tie into children who aren't enjoying school, who may be bullied in school. So for them, it's actually been a relief. It's been a release from the day-to-day living. So we have to remember that. There's always that aspect. In terms of the overall consequences of the pandemic on mental health, the best study has come out of the UK, where they have a cohort study where they had information on young people before, and then they surveyed them using postal survey during the pandemic, the lockdown, and they found the increase was in anxiety was the biggest difference that they noticed, and also in loneliness. So they were the two things that were coming out, and what they found was it was the older adolescents and young adults who were suffering the most. So to get back to what I was saying about people, reacting differently. I mean, I suppose you could think of young people in terms of three big groups. There's the preschool, primary school group, and then there's the secondary school, and then third level. And I think they all have had different kinds of experiences. primary school kids, in terms of they've had more time at home, their parents have been with them more. The homeschooling was probably easier in terms of parents being able to help them. They've gone back to school now in Ireland, and they don't have to wear masks. So things are a little more normal for that group, I think, the primary school children. The secondary school children, they seem to be coping, but they are wearing masks, and a lot of the things that made secondary school different from primary school are now gone. The moving from classroom to classroom, the lockers, the hanging out, the after school activities. And so I think that, that maybe the first years don't know what they're missing, but the others certainly do. And I think sixth years are very anxious because they have the Leaving Cert coming up, and there's this uncertainty all over again. So every single class assessment is now a source of anxiety. I have to do the very best I can. And then I think the group that are suffering possibly the most will be the third level students, particularly the ones just entering third level. This is a completely different experience to what it should be, completely. This is totally online. They're not meeting anyone. There are no societies going on. And for them, it's only a 4-year degree, and that first year, they're not going to get to know their class. So I do have concerns about that age group, and I think we need to, I know our Minister for Higher Education is putting some, extra counselling in place in colleges, but I think this group need to be helped more, I think.
Thanks. And that's a big challenge for us in RCSI and in the other universities, which we're trying to deal with by getting far more engaged with our students really from the start. And I think it's interesting that older group as well, they've had a bad rap in the press, whereas the majority of them, I think, are working really hard and very responsibly to prevent transmission.
Yeah. I mean, they naturally when the restrictions were eased a little during the summer, they took advantage of that, and they were meeting. Now, it was mainly outdoors, but they did congregate in large groups. But it's hard to blame them. It's a very, the function, if you like, the core function of young adults is to meet, to form relationships, to this is a key time of their life to do that, and they're wired to do that, to socialize. So we can't criticize them for doing that. And most of them, as we know from our own students, are really doing the best they can.
Yeah. And they're trying to form an identity and develop an aura, and it's very different. So when for parents then watching this and caregivers watching this, Mary, children, if they're feeling stressed or coming up to being a little bit overwhelmed or being over anxious, how can parents and caregivers recognize when young people are stressed or starting to feel a bit overwhelmed, or where the anxiety is maybe getting a little bit on
too much
increased?
Yeah. Well, the first thing, as I said, is anxiety is normal. We're in a pandemic situation, so everyone's feeling a little more anxious than they were. I suppose with young children, what you'll notice is they're more clingy, more tearful, maybe difficulties with sleep, questioning, asking questions a lot, and not don't seem to be listening to the answers, just keeping asking the same questions. With the older children, the adolescents, young adults, they will, I suppose, they will recognize that they're feeling anxious, and they may actually tell you that, but it may manifest in terms of somatic symptoms, like feeling that their heart's beating too fast, that they can't breathe properly, their pains and aches. Often these kind of symptoms are a manifestation of anxiety in older adolescents. And problems with sleeping, either not sleeping or oversleeping, or else with eating, not eating, or overeating. So it's very hard you just have to watch out for changes in behavior. And we are seeing, unlike as Jonathan was saying, with there's a decrease in presentations for viral respiratory illnesses to the ED departments. We're seeing an increase in presentations with mental health problems in older adolescents to the emergency departments.
And I think that the mental health problems may go on much longer after the pandemic is the actual pandemic.
That's the theory, but we can. It's not inevitable, and we can do something about that. Yes.
So your advice for parents then in general, helping children, young people to deal with anxiety. What should parents be thinking? What should they be doing?
Well, I suppose the classic thing to say is, you know, like in those days when we used to have air travel and we were traveling, and the safety announcement would come and they'd put on your mask first, but you know, before you help others. So parents really have to get to grips with their own anxiety, because a child will not, if the house is full of anxiety and parents are constantly watching the media, constantly worried about what's going on, constantly, you know, railing against the lockdown, the restrictions that actually we've no control over. We have to do what, you know, has been the government has set out these restrictions. We can't. There's no point, you know, kind of upsetting children by you know, seeming to contradict what's happening. You can do that yourselves among each other, but do try and deal with the parents' own anxiety. Parents should not be resorting to substance use, to alcohol or other substances to control their anxiety in front of the children. That's not helpful. It'll affect their parenting. What we've shown in our research is that for children who have undergoing adversity, and this is a form of adversity, this pandemic, that the main things that parents can do to help children overcome this is to show warmth, and parental warmth is a very good protective factor, and also boosting your child's self-esteem.
Yeah. That's great, thanks. And I think we'll put up some materials, some websites and places that people can go for advice. We'll come back around. Paul, can I turn back to you? We talked earlier about uncomplicated and more complicated respiratory conditions that occur more frequently in winter. How is this winter different then? You know, being in this situation, what are the differences that you see?
So I suppose the main thing, I suppose a lot of the talk in the summer and coming into the second lockdown, I suppose, and the idea that kids were going back to school was in relation to coughing. And I suppose coughing is the main symptom of COVID, the main symptom that's flagged. And so I suppose we knew coming into this winter that this was going to pose a problem, because cough is a very common symptom in children. And I mean, I think if you look at all children in Ireland this winter, the amount of coughing that's attributable to COVID and the amount of coughing that's attributable to something else, it's overwhelmingly something else other than COVID. But I suppose we have to be very careful, and we have to ensure that we're protecting each other and ourselves. And there's obviously good advice on the HSE website for the different age groups and from the Department of Education about what we have to do when we see cough. So I suppose one of our concerns going into this winter is the children who have a cough or cough a lot for a reason other than COVID, who might be repeatedly sent home from school, or you know, the stigma when you're out and about and you see a child coughing. So some children cough a lot for various different reasons, and I suppose it's trying to help parents to understand what symptoms are just related to normal stuff and what symptoms that are potentially preventable if we just had a little bit of understanding and insight. And so I suppose we're probably seeing a fair bit of that this year, of children who are missing much more school than they should do for something that's quite treatable. Yeah. And I suppose the other issue is because cough is such a kind of an unwanted symptom this year, is the risk, I suppose, of over-treating symptoms with lots of steroids, lots of antibiotics that may not be necessarily warranted, and I think lots and lots of GP visits because parents are concerned, the schools are concerned, and everybody wants a bit of an answer. And unfortunately, I think as we've come to learn, there isn't an answer for a lot of these things because the symptoms overlap so much. So it's really just about getting the appropriate information, ensuring parents and caregivers are really well informed about the symptoms of COVID and then the symptoms of other preventable things, and ensuring that we have access to that information. I suppose it's one thing that can reduce anxiety a little bit is possessing information, because a lack of information sometimes makes people anxious.
Yeah, that's absolutely good. And I think the other side of that coin, I agree with you 100% there. The other side is too much information can make people anxious as well, because there's such an overload of information now that people are subjected to. So the key, I think, is that people will get good information, reliable information, but not be overwhelmed by the amount of information that they're getting.
Yeah, it's something that specifically we were thinking about this year, and I mean, if you go and look up coughing in children, or trying to get an explanation about coughing in children, unfortunately, that's what you get. Is you get enormous amounts of information, a lot of it contradicting each other, and then very, very hard to figure out what's what. And so this year, actually coming into the winter, between the 3 Dublin Children's Hospitals, we developed some patient and parent facing literature to kind of explain some of the context of coughing in the era of COVID, and to explain some of the common conditions that cause troublesome or persistent coughing in children. And it's quite simple. There's a few quite simple key patterns that parents can spot. And I suppose we did that with the hope that we'd weed out some of these children who are getting unnecessary treatment, or weren't getting treatment where treatment would have improved their quality of life.
And we'll make those available on the RCSI website, because I think that'd be very helpful for parents and for caregivers. Thanks for that. But Jonathan, coming back to the whole allergy question situation, we're obviously spending, as you say, an awful lot more time in our homes during this period, and increasingly so as we get into winter. Are there things that parents and caregivers kids can do in our everyday routines that can help to manage the symptoms of allergies, or what are the best ways of managing those symptoms?
Well, I think exercise and being outdoors is good for people. Even allowing your children to be in your own garden is going to be better for them than watching the news on a loop, which is very bad for their mental health. It's even bad for my mental health. Watch the news once a day and don't make your children watch it at all is one thing. But I think we've got to reassure ourselves that children are resilient. And if you can reassure a child that this is going to pass, like, the winter is always followed by spring, we are going to come out of this, presidents change, people move on. We've got to allow children enjoy their time of childhood without imposing the sort of the rigors of worrying about the lady down the road who had a cough yesterday. We've got to keep it within our own family and reassure them that they're okay, and they'll be okay. And there's nothing that makes you feel okay more than your child saying things are fine. Children will pay you back with reassurance that if they feel okay, you should be okay as well.
Yeah, and I think it's fantastic to see kids out and about, running around in parks and jumping off swings and all of that with their parents. Certainly what I'm seeing is lots more families out and about together, cycling together.
I think the children mixing is good. It's the parents standing beside each other, too close together, sharing coffee and chat. I think we need the parents to be standing further apart and let the children just run.
Yeah, that makes a great deal of sense. We've been talking mainly about respiratory conditions and allergies there, Jonathan. There are obviously broader health issues for the parents need to think about and consider as we're going into winter.
Well, I'd just like to repeat, I think we need to let children have as normal a life as we can. They're tolerating school. Schools are not huge dens of COVID transmission as far as we can see. And I think teachers need to be reassured about that too. The passage of coronavirus from child to child or child to teacher is much lower than between adults, for instance. So we need to reassure them about that. We need to let them exercise. We need to let them meet their friends within reason, within their social bubbles, according to the guidelines. I don't think we should be sneaking children into houses for sleepovers, etc., because that's not a good community practice, that the children are doing something slightly naughty to beat the system. I think we need to get away from the cute tourism of Ireland of trying to beat the guidelines and live with them and learn to adapt to them. Children will adapt to rules. They live by rules. And as long as the parents aren't constantly disrespecting the rules or denigrating them, kids will get by. Kids will get by.
That's very interesting, because that also means we're educating children about the common good, socializing children to see that there is something, which is the common good. It's part of growing up to start to understand that. Mary, just for parents and for carers watching this, where would you advise people to go for reputable sources of information for supporting their children's mental health during this period, children and young people?
Yeah, there's actually a lot of information online at the moment. I suppose one of the good effects from hopefully lasting effects from the pandemic is that mental health may move more to digital technologies and providing information and treatment even in that way. I would recommend and there's a sheet that we'll be putting up on the website. There are resources like spunout.ie, who have a huge range of information for young people that they can access, and parents can also, in a very readable format, parents can also look at this. There's a text line recently launched, which is excellent, you text 50808 and people, they'll get back to you. A young person can do this, or an older person, all ages, but you'll get someone within a few minutes, you'll have somebody at the other end of the line saying, how are you, what do you want to talk about? There's Jigsaw.ie for young people, specifically up to the age of 25, and they can provide sessions of counselling if needed, and I think they're providing online as well as some face-to-face. There's MyMind.ie, which is a free, again, counselling sort of service provided by HSE, which people don't, I think, know about enough. And then, of course, a GP is a great resource if parents are concerned, if it's got to that level where these kind of interventions won't help. Talk to your GP, and of course for children who are really struggling, and I mean really struggling and in need of specialist help, they can be referred to the Child and Adolescent Mental Health Service called CAMHS, and that is open. It's all been open all the way through the pandemic.
Mary, for parents and for caregivers of children watching us, watching this evening, what would be your main takeaway messages for them in relation to the well-being of children and young people during this time?
Well, my main takeaway is try to focus on the positive. Now that may sound a strange thing to say in the middle of a pandemic, but focus on not just the restrictions, but on the permissions and what we're allowed to do, and to make the most of those, and enjoy the outdoors, enjoy our wonderful country, our wonderful landscape, and enjoy the sense of family that has been nurtured during this pandemic, and the sense of community, which has become really important. Like Ireland as a community in this together was a big unifying kind of message in the early days, and we should hang on to that. And parents, the other key message is parents look after their own anxiety, and remember that young people are very resilient, and they can cope with so much, particularly with a nurturing family to support them. And the last thing is to remember this will be over, and we will look back on it as a distant memory.
Thanks very much. That's a tremendously hopeful note to end that part of. Paul, can I ask you the same question then? What would be your main takeaway as a pediatrician, practicing pediatrician? What would your main takeaway be for people watching this tonight?
Yeah, so I mean, I'd echo everything that Mary says. I suppose from a respiratory perspective, I suppose that it's difficult in that there's a lot of overlap of symptoms. But what's reassuring is children are much less affected with COVID than older people, even children with pre-existing conditions like asthma. And again, information is power. It's really important to have balanced information and not to be worrying excessively. So there's good information on the HSE websites, on the Department of Education website, as we mentioned on the Children's Health Ireland websites, and I know it's going to be on the Crumlin website. We've got some balanced information for parents in relation to respiratory symptoms.
Yeah, so it's really to educate oneself about what the situation is and get solid, good information that's reliable. Thanks very much for that, Paul. And Jonathan, what would your sense would be, your main take home?
Well, one specific thing to say is that the children in their exam years, the junior cert and the leaving cert, need to get their hay fever plan in place before Easter, so that they're not suffering their hay fever problems during their exam performance, because when it's uncontrolled, their exam performance is poorer. And we've got to do everything this year, like every year, to let people be able to give it their best shot. But again, this too will pass. And the reassurance that we have that getting back into schools and mixing socially as much as they are allowed in schools hasn't caused this second wave should be reassuring for families that their children are healthy, are resilient, will get through it, and will learn, play, and socialize as much as they possibly can within the restrictions that, as a community, we have to live. We don't want children to think that they are personally being restricted. We're in this together. The game is only at half time, and we've another half to play of getting through this, as Mary said.
Excellent. Well, that concludes our discussion for today. Thank you all very much, not just for the information that you've provided, but I think all three of you have been a very calming, reassuring presence here tonight. I think that's most valuable. My thanks to our guest speakers, Professor Mary Cannon, Professor Jonathan Hurahan, and Professor Paul McNally. The next event in the MyHealth series is a three-part Positive Health mini-series hosted by the RCSI Centre for Positive Psychology and Health. The first event of this mini-series will focus on the science of happiness, and it will air on Tuesday, the 19th of January, 2021. More information about this and other events in the Positive Health mini-series will be made available on the RCSI website and across all of the RCSI social media channels. So in closing, it's a tough time and it's an adverse time, but as I think we've heard in this session, you know, there is light at the end of the tunnel. We will come through this, and we adapt. Our children adapt, and we will get through it. It just leaves me to say that I hope you're all continuing to stay safe and well during these uncertain times. So goodbye from the RCSI, and stay safe.